Okay, everybody, welcome to the first Stoneridge Speaker Series of 2021. I think we can all say 2020 has been what a year. Been a very interesting time. A lot of things from regulatory issues to our pandemic. M&A deals have gone crazy the last half of the year, so it's a lot of things to talk about. But I am very happy and pleased to be here with three of my esteemed colleagues, two of my partners, Joe Lynch and Brian Heck, and then the president of NOC, Bill Dombi. We're welcome to have him here as our guest. For those who haven't attended these are fireside chats, so each one will get a few minutes to introduce themselves, give some general comments on the industry, and then we'll move into a fireside chat. You guys can send me questions through the Zoom platform, and then at the end, or throughout the presentation, I'll ask those questions as well. I'll interject them or try to cover them. We do have always a hard stop at an hour, but you can always email us and we'll follow up with you with other questions. So with that, I'll kick it off. 2020, like I said, it was just an absolutely crazy year. We'll dive into some of those changes. The guys that are on the meeting today have a varied background. Joe, he'll introduce himself, but he's definitely our home care and hospice. One of our home care and hospice specialists. He's an entrepreneur and is a owner of Stoneridge with me. Brian Heck and I have worked together for a long, long time. He is a specialist in the behavioral health side and works heavy in the intellectual and developmental disability fields. And then obviously Bill is I don't want to say all-knowing, but on the NOC side, he's the guy in charge of that association when it comes to home care and hospice. Joe, why don't you kick it off and kind of introduce yourself and give us some comments on 2020 and more particularly what 2021 looks like.
Very good. Well, thanks, Rich. I'm happy to be here, especially with Brian and Bill. Bill, thank you for joining. I'll give a quick summation of my professional life. I've started in home care in 1990. Was involved with a large hospital corporation for 7 years. We bought and acquired a number of hospital-based home care operations. That company merged, and I'm sorry, Rich, I'm getting a little bit of reverb here. Yeah, I'm seeing a comment here that we've got some echo. Well, I'll just keep going.
See if it helps if you mute yourself. Okay, thanks.
Okay. So in 1997, that company merged with Tenet to create a pretty large hospital organization, obviously. At that point, I stepped out. By that, I'd started so many companies working for a large organization that I decided to do it on my own. So I started a home care operation, added in home health later, acquired a couple operations along the way, look at countless others to acquire, and I built that company up through acquisition and organic growth over 17 years. I sold it in 2014. Stoneridge helped me with that sale, and our founder, Don Cummins, at that point asked me to join the team. I did because I always enjoyed the M&A side of things, and here I am today. In terms of the home care and hospice market, I'd say we have a very strong market. It's been strong for a number of years. Right now, an additional accelerator to the growth is an ever-increasing demand and a decrease in supply currently, and I attribute a lot of that to COVID. A lot of the folks that I worked with in 2020 were having great years until the spring hit, and then they realized that they wouldn't be able to get as much as they wanted. That didn't happen across the board, but it happened with several of them. And from conversations with our partners, I think that if our firm is a microcosm of the home care and hospice universe, I'd say that probably happened across the spectrum, resulting in a decrease in supply. But the buyers, some of the larger strategics took a step back initially, but then they came back strong. Meanwhile, the smaller guys were still out there doing what they do. And that's created a real high demand for quality companies. So who's buying? Big strategics, medium strategics, small regional strategics, independents, and the financial buyers of all shapes and sizes. A lot of people ask me, and throughout my days, what's driving this? What's been driving it for the number of years that it's been such a popular place to be? And I think the lead answer is statistics and demographics. But I think I'd be remiss if I didn't mention that the Encompass Health South deal in 2014 was really a driver for bringing, I think, a lot more of the financial buyers into the mix. They saw that deal. It was a very public deal, and they decided they wanted to do the same thing. But let's jump back to the statistics, because that's important here. The World Health Organization stated that in 2019, we had 703 million people in the world over the age of 65. They're estimating that number will be approximately 1.5 billion by 2050. These are things that probably everybody listening in on this call today, these are statistics that everybody knows. The age wave, certainly in America and across the world, that's driven by longer longevity in life is attributed by healthcare technology, better understanding of what a healthy lifestyle looks like, better diet, safer cars, etc. All of this is coupled with the desire of hospitals to get people out of their acute care setting as quickly as possible, and that is one of the most logical options at that point is home care and hospice. So in terms of 2021, I think our future looks bright. Our industry is not without its challenges, certainly. We've been dealing with them for a number of years, but I think that for quality operators, the opportunities will be almost limitless. So I'm bullish on where we sit and where we're going, and I think we have a wonderful platform to help a lot of people.
Thanks, Joe. Bill, you want to go next? Split up the Stoneridge folks and tell us a little bit what's going on.
Yeah, thanks, Rich, and thanks to Stoneridge for inviting me to be part of this. My name is Bill Dombi, president of the National Association for Home Care and Hospice. My tenure in home care actually goes back to the mid to late 70s. For the people on the call, they may not even know what that time was like. At that point, home health agencies could only be not-for-profits or be part of a hospital system. So the world has changed a lot since that time relative to home health. And back in that time, there were no hospices because there was no Medicare hospice benefit. So we have seen, over that period of just over 40 years, a remarkable change in healthcare, all geared towards care in the home. It's not been an easy ride. There were institutional challenges to deal with more than just bricks and mortar, but there was a bias. People thought you honor people by letting them sit in a hospital bed somewhere, which is not really the best way to honor somebody. It's to honor them with them in control in their own home. We have seen all kinds of growth, all kinds of variations on the theme and the delivery of care, and I'm really looking forward to getting involved in our discussions here. So I'll close just with one little reflection that this is the era of care in the home. The opportunities are boundless, and they've never been anything close to this before. We are looking now at transforming the actual delivery of services in the home to embrace what the capabilities have been for years, which is not just a post-acute service approach or an end-of-life service approach, but pre-acute, acute, post-acute, end-of-life, beginning of life, all with care in the home, with a great integration of technology, an integration of more disciplines of care than we've seen before, but with just one challenge to the home care and hospice community, which is there are no bad ideas. They're just people who are sitting in the audience still waiting for things to happen around them, that they need to get in the game in order to take advantage of all of these opportunities. And the innovations that took home care and hospice to the point where it is today is the same kind of energy you want to see on a going forward basis to embrace all of these opportunities. At the National Association, we do a lot of government relations work, lobbying, as they call it. That's not going to go away in terms of the government's involvement with care in the home. In fact, it may even increase more in the private duty sector, but it's there in full force in home health and hospice already. But I think we can turn that into a partnership rather than an enemy type approach with the government more so. And we've demonstrated that that does work. So I'm really looking forward to 2021. I'm looking forward to 2022 and 2023. And I don't know, Joe, I'm not so sure I'm looking forward to fitting into those statistics that you gave of the age wave. Well, wait a minute, I'm already in those statistics, so anyway, thanks again, Rich, for inviting me.
Thanks, Bill. Mr. Heck?
Yep. Hey, Rich. Thanks. So just to give my background real quick, and I'll be fairly brief. I've spent about 15 years in the behavioral health world, but really more specifically the intellectual and developmental disabilities world. I started with ResCare, which is now BrightSpring. Spent about 10 years over there. When I left, I was their VP of development, responsible for most of their transactions. And I've been over here on the Stoneridge side for about 4 or 5 years. So in total, in those 15 years, I've done about 80 deals in the space, a little bit over 30 states that I've done deals in now. The intellectual development disability world is just a little bit of a different model. And so I'll talk through it briefly just for those that might not be too aware of the services. Rich, we get you on mute if you don't mind. Thanks. So really 3 different models in kind of the IDD space. You've got group homes, which are 24-hour staff settings, anywhere from 3 folks to 6 folks living in a residential home. Looks just like one in your neighborhood, probably. Then you've got host home models, which are, the host home looks a lot more like what you would call adult foster care. So an individual with a developmental disability living with a family that cares for them 24/7, and that's kind of reimbursed on a per diem model. Then you've got periodic services where you might have an individual that just needs a few hours a day of support, and so they're living in their own apartment. And they receive 3 or 4 hours a day or 10 hours a week or whatever that might look like, which is obviously kind of the least restrictive type setting for these folks, and one that you really kind of try to push folks into over time if it's possible. So these services obviously are funded through long-term Medicaid dollars. About 80 to 85% come from Medicaid, the balance coming from states and in certain counties as well. Not quite as big as the home health industry, but it is still a $70 billion industry and growing. Most folks with a intellectual or developmental disability diagnosis are still actually living at home with a caregiver. So you're looking at about 70% of people with this diagnosis are currently living in their natural family home. And as we've talked about with aging populations, and I'm not quite yet in that age bracket yet, but with that population aging, this 70% that still live at home, those services are going to be exploding significantly over the next 20 to 25 years. So because of that, we're seeing a lot of interest in the M&A market. Similar to home health, you're finding buyers of all different types. You've got financial buyers, you've got strategic buyers, and we've seen a lot of kind of this roll up of businesses into the $20 or $25 million range. And then now we're seeing some significantly larger ones starting to trade hands too, which we'll talk about in a little bit here. But 2020 has been a good year for deals in the space. Acquirers have been busy. COVID obviously derailed things a bit, specifically because of day services where you've got congregate settings and lots of folks under one roof. So that's been a little bit of a challenge, but the appetite has certainly been there for transactions in 2020 and even the start of 2021. Anything that I've taken out to market so far this year has been very warmly received by the market, and there's a lot of interest in the space. And we'll go into detail in just a little bit on that. Rich?
Sounds great. Thank you, Brian. So for those who don't know, Stoneridge focuses mostly on home care, home health, hospice, and behavioral health. And as you guys can probably imagine, March, April of last year it started a very slow period, but Q3 and Q4 in our industry of M&A and consulting work that Stoneridge does has really, really kicked off the end of the last year and kicked off 2021. And we're excited about the activity going forward. So with that, let's dive into some stuff. Let's start with Bill. We're going to tackle the elephants in the room first, right? The real obvious stuff. COVID-19, but Bill, from your perspective, why don't we just do this in a couple of ways? Because there's a couple other things that happened to home health and in your industry that started before COVID, right? You had PDGM. So why don't we talk a little bit about 2020, all the different things that you saw? I mean, from my perspective, one of the reasons Joe mentioned that we had a slowing down. You look at 2020, you had a presidential election that was like no other. You had PDGM and home health. You also had you had that in the skilled nursing starting in November of 19, and then you have COVID, obviously that we're still battling against. Although I think we're starting to see. I don't know if we can actually see it yet, but we think the end of it is getting closer, or at least some livable format of it. So with that, Bill, why don't you talk about 2020, all the things that impacted it, and how it rolls into 2021?
Well, if I start off 12 months ago from today, we look at it and we say, what was the focus of home care at that point? And from a home health agency standpoint, it was all PDGM, on February the 10th, 2020. For the hospices, it was, we're continuing to grow. Let's consider where we go with palliative care, see if we could expand, the space that we operate under. And the personal care services side of home care, was just in the focus of demographics. Where are we going to get our workforce? Where are we going to get our workforce? And how are we going to pay them? Because there are so many people who have jobs that pay better than that. And then we find ourselves a month later. I actually found myself in San Antonio, Texas, that first week of March. San Antonio, Texas, where they dropped off a cruise ship full of people who had been exposed to this new virus that had surfaced. And San Antonio itself was in a bit of a panic because they started letting some of those people out into the community. They were seen at shopping malls and hotels and the like. And we then saw everything in home health care, hospice, and home care turn upside down almost overnight, driven by panic in many ways that was warranted. But then when cooler heads were starting to prevail, they said, where do we get PPE? And the home health agencies are saying, well, wait a minute, we're just really getting into PDGM. How can we handle both of these things at the same time? Fast forward it to the middle of June, PPE still remains a problem, workforce still remains a problem, but all of those care sectors in home care that I mentioned are taking on COVID-19 positive patients while serving the patient population that they had generally served, albeit with some differences, differences such as telehealth services in home health and in hospice care, but also dealing with patient hesitancies in terms of how do you show up at the home fewer times, still make a go of it to meet the clinical needs of the individuals, and make a go of it as a business too, because on home health, the fewer visits meant lupus were coming in. If you weren't paying attention to lupus before, you sure were paying attention to them, in the months of April, May, and June on the home health sphere. And hospices were going ahead okay, but it was still a bit of a rough ride. And then we started seeing not just more COVID patients coming in, but patients overall coming in, partly because the nursing homes had closed their doors, partly because if their doors were open in those congregate care settings, people didn't want to use those care settings. And we also saw health systems, hospitals, diverting patients from not just the emergency room, but the waiting room of the waiting room to get into the emergency room, because they were so stressed out with surges happening, and they were diverting them home. And home care companies were coming together with a package of services the combined third-party payment with additional resources to care for a higher acuity patient, including those that were COVID. And then, we find ourselves in September, October, and we now have demand exceeding supply. Part of the supply problem was staff were getting infected too. In fact, some home care staff have died as a result of COVID, but still there was a demand. So while other healthcare sectors were hoping someday to get to pre-COVID levels, much of home care, home health agencies and hospices were exceeding it already at that point in time, while continuing to admit the COVID patients and caring for them effectively, probably more COVID patients in a home care setting than in a hospital setting at that point. And then people took a little bit deep breath, as they saw the final PDGM rule come out at the end of October, early November, and they said, oh, did we forget about PDGM? And the home health agency started looking at where they went, and they had managed their way through PDGM without much difficulty. It wasn't as disruptive, perhaps, as it might have been. And that brings us to where we are today. We're in another surge, maybe passing through that surge. And we are seeing proposals coming out of CMS for creating a hospital at home program. And we're pushing one on a skilled nursing facility at home program as well. So we look back at 2020, and I used to be a big fan of a ride that was at Disney World that's no longer there. My favorite ride was a simple one called Mr. Toad's Wild Ride. You didn't know when you were going to turn left or right, and it was jerking you around. And that's kind of the way home care went throughout 2020. But just as I survived that ride at Disney World, home care not only has survived it, but they've thrived under it. And so in a reflection on 2020, we see the awareness of what it can do in care in the home, how deep and wide it can be, that awareness in the public, in the payer sources, and in the rest of healthcare. And that is something we made a quantum leap ahead relative to that. And in some respects, you can't ignore crediting telehealth services for helping it to be there, because as a tool, it became extraordinarily valuable and became in widespread use with a very likely, very positive future as a big tool in that home care toolbox. So looking over on 2021, as much as healthcare had real difficulties, home care did well. I'll credit one other thing. There was stabilization support that might have affected mergers and acquisitions. Providers got advanced payments from the Medicare program. Providers qualified for provider relief fund monies. Many of the home care companies could qualify for the SBA Paycheck Protection Program loans that will become grants for many of them. So that cash was coming in, allowing for those providers to be able to make it through some difficult times. So, I think the system really worked well for home care. Maybe it did better for them than others.
Great. Hey, Joe, real quick, let's hop over to you on the PDGM. I think Bill's right. I mean, it's like we forgot about it from June till the end of the year. How do you think it affected the deal market in home health?
I really, I saw a little bit of trepidation on the very front end, but I mean, PDGM, it's always scary to go through a different change. I remember when we went from cost reimbursed to prospective payment, and everybody was scared then as well. I think the operators that succeed in that and going through those changes are the ones that say, okay, do I want to get out of this business because of this change? And if the answer is no, well, then you better roll up your sleeves and figure it out. And 99% of all the ones that I dealt with fell into that category. So they were addressing that fear, and it is a fear. It's a change, and nobody likes change. But they were addressing that in the late summer, all throughout the fall. And most of the folks that I was talking with, by the time the holidays came and went, they were pretty much ready for it. And that didn't. I didn't notice a big change from the buyers. And so when they get on the call, the first with the seller, the first question is, how are you going to handle PDGM? And they roll out this comprehensive plan, and everybody goes, oh, Okay. and then the deal proceeded. I was involved in one where they had zero plan, and that didn't go real well. But by and large, I just didn't see a big hiccup. Like I said, it's just it's part of the process. And if you embrace it, then there's really nothing to fear. And everybody that I saw did, and it didn't affect their deal flow, my deal flow.
Yeah, I would agree with you, Joe. I think overall it was, I don't want to say it was a non-event because there was a lot of preparation, a lot of work, and referral sources come from the referral sources switched a little bit, but from a deal side and valuation, it really wasn't, it wasn't that big of a deal from an M&A perspective. And there. So Brian, let's hop back onto your side. Slightly different community business, obviously, but slightly different clientele and the way you deliver the services. What did COVID do for intellectual and developmental disabilities, and how does that affect the deal process?
Yeah, so COVID, again, to be honest with you, it hasn't had a significant impact on deal flow and deal processes. Thankfully, residential services are an essential service. It's where these folks live, and it's services that they have to have to get by with their daily living. So it's an essential service. Periodic services in the home, same as home care. These folks need support. It's an essential service. It didn't really change. The one place that it did, and I touched on it earlier, was in the day services. So folks that receive, day habilitation services in a group setting, that changed. Now most states adapted to it and made some reimbursement changes to where folks were allowed to receive those services in the home or in a limited setting. But some of those are starting to sunset, and so now we've got to really start looking at, okay, how does this look going forward? But I'll tell you, most of the buyers that I've been working with, most of the folks in the space, they're sophisticated enough to understand that they can kind of model this going forward, going back to some sense of normalcy as vaccines roll out, as we approach kind of the and I don't want to get too political, but as we approach kind of the herd immunity and folks things going back to a bit of normalcy, I'm seeing most of my folks planning on summer, fall, having typical day programs up and running and operating, and so they're really modeling just as they were in February of 2020 for the most part. Now there's a few really specific caveats to that, but in general, it has not had a huge impact on the market.
Rich, if I could add just this for a second, compared to, as Joe mentioned, when home health moved from cost reimbursement to prospective pay in the late 90s, neither PDGM nor COVID was very disruptive. And one sign of it, is that back in the late 90s, 40% of home health agencies shut down in an 18-month period, and there were fire sales galore. You could get people to pay you to take a home health agency off their hands for the liabilities that they had. We have not seen anything, and you guys, have your finger on this pulse. We have not seen any sign of a fire sale relative to valuation. It's stayed steady, if not value going up, even throughout this crisis.
I couldn't agree with you more. So Bill, I lived through that, and the people I worked for back in the 90s, late 90s and early 2000s, we would buy agencies for picking up their last payroll. I'll pay payroll next Friday, and the agency's mine. And we bought several that way back then. And sitting in 19, at the end of 19, going into 20, I actually put together a couple teams here at Stoneridge that were going to be these PDGM liquidation sales, right? How are we going to handle this high volume of failures, right? Because they have assets, they have, well, we thought they were going to be failures, but they have assets, and they have patients and consumers. There's still value. They have licenses. It's a business concern. December of 19, we just didn't know how the cash flow would affect. And you had PDGM, you had the RAP payments. There's a bunch of things going on in cash flow. And we put together two different teams. We thought the volume would be huge, and it was almost non-existent. We probably did what I would call 2 or 3 non-traditional M&A deals in the beginning of 2020. And there were companies that were already having problems pre pre the change in the payment system. So to echo your point, Bill, we didn't see it at all. And we kept waiting. And if you go back and look at some of the speaker series that we did, we thought it would be Q1, then we thought it would be Q2, then in Q2 we thought it might be in the fall, and it just never has happened. And I don't think it's going to happen, right? I mean, I think the ones that have failed or will fail were failing before. So the industry was a lot more responsive. And to Joe's point, they started being responsive prior to the effective date of PDGM, and they were ready for it. And it was a successful switch. And I think just as big of a switch as cost of prospective payment, it was a major payment change difference. But I think it went over without I don't want to say without a hitch, but it went pretty well as far as things could go. So I agree with you wholeheartely. Let's kind of turn the focus to the future. So Heck, let's hop back with you and go in reverse order there. So what does this look like for 2021? Deal volume, deal size, what makes and we represent mostly sellers. We do some buy work, but so when you have a seller, what makes them attractive, and you know, you can talk about states or whatever you want to talk about that are most active, but let's go down that route and talk about what 2021 looks like for M&A for you.
Yeah, so just from a deal flow perspective in 2021, you know, what I'm most excited about is that we've seen, you know, 3 or 4 $200 million plus players in the market trade hands in the past 12 or 18 months. And keep in mind, of the $70 billion in this market, there's a couple of folks that are about 1.5% to 2% of the market. And then you're really talking about a steep drop off when you get to kind of the next level. And that next level is, you know, the 200, there's a couple of $500 million, but you find a lot more in the $200 million range. And we've had 3 or 4 of those trade hands in the past 18 months to buyers who are now going to be very active and out looking. But on top of that, you've got, you know, kind of this next batch of $25 to $50 million providers. And we've worked on deals personally here at Stoneridge out on the West Coast, in Texas, a couple in the Midwest, in that size range, that have now been acquired or are in the process of being acquired. And so we're bringing a whole new batch of potential buyers to the market here. And so for me, that's really exciting for the folks that are less than $10 million in revenue, or you know, even up to the $15 or $20 million line. You've now got this entire new pool of potential buyers that are owned by, a lot of them by private equity, and they're not looking to just grow steadily organically. These folks are looking to get out and actively acquire in the space. And so I think it kind of an influx of new blood into this market is going to be really exciting for folks in the $3 million, $5 million, $10 million range, where they can sell and potentially bolt on to some of these that are working on kind of the next layer of roll-ups. So I think 2021 is going to be really, really exciting from that perspective. I do expect kind of record deal flow, assuming that we go back to a sense of normalcy, before the end of the year. I think we're going to see some really big numbers in the DD space.
Great, that's exciting. Joe, how about the same question to you? What does 2021 look like from a deal perspective? What makes buy or sellers attractive, and hurdles for them to come out to market?
I'm pretty optimistic about 2021. I'm hoping we get on the other side of this pandemic. I'm sure everybody is at this point. One of the things that whenever I speak at conferences, when we used to have conferences, that I always talk to folks about what makes their agency a challenge, and there are 2 different obstacles that I'll lump them into. One is market driven. Size and location are the 2 obvious things that come to mind. If you're in a podunk town in rural America, then that's probably a little bit harder to sell. Your size, if you're $20 million in that small town of revenue, well, then that probably is going to be a big difference maker as opposed to being $1 million in revenue. The other obstacles are self-imposed. Poor financials, lack of attention to the process when you get into the process. If they ask for information and you don't supply it, that's a problem. Unrealistic expectations. If you speak with an advisor on the front end and they say your company's worth $2 million, but you want $10 million, that's going to be a hamper for you, but that's going to hamper the process for you. Generally speaking, though, pandemic in terms of 2021, and getting back to your question, if a company has a good, solid top line with growth that's been happening consistently, and it looks like it will happen into the future, and they have a good, solid bottom line, a 10 to 20% adjusted EBITDA, and you're organized and ready to receive buyers, you can probably sell your company, because there's a lot of buyers out there. There's a lot of demand that, as we've already discussed at length, that hasn't let up. So I think 2021 for those that want to stick their big toe in the water is going to be a very, very active year.
So let's switch back a little bit, take that note. So, when we look at deal flow, the end of the year in 2020 was high volume, that's carrying over to 2021. Valuations, as we know in our space, have never been higher, and that's a true statement for the last several years, right? We have a newsletter we produce called the Home Health Index, and valuations have just gone up for 20 years, but the last 5 years have been really strong, and they got a little stronger in 2020 because of the lack of businesses on the market compared to the number of buyers, the asymmetrical balance between buyers and sellers. But so that's one side, and then you have all the demographics that we've talked about, and everything going in favor of what we do. People want to be in the home; they want to receive the care there, with or without the COVID fear. But on the other side, then we have the regulatory changes. Bill, so I'm coming back to you. We have the regulatory changes and proposed reimbursement changes. So if you can put a crystal ball together, which I know is always dangerous to do, but what does reimbursement look like going forward? If you read, which I try to do, you read all the recommendations, the MedPAC stuff, and how do you think that actually plays out? What does it look like for home health in 2021 and beyond, and how does it look for hospice?
Well, I think 2021 is pretty much set on where it will be reimbursement wise, because those, on the Medicare side at least, those rules are in play for the whole year, for calendar year for home health, and through the end of September for hospice. And we would have to expect they would stay reasonably stable, that nobody would be jumping the gun, and trying to rely upon some rough elements of 2020 data to make some changes. We do have MedPAC out there. MedPAC continues to make recommendations, now shifting some of its focus over to hospice, even beyond home health, but still saying, the margins are high, and so they should either cut the rates, rebase the rates, reduce, the inflation updates. But hospice also, has that focus coming from MedPAC in terms of the aggregate cap, the annual aggregate cap. They're recommending a reduction by 20%. It does not look likely that you'll see nothing that'll affect 2021. It will surface legislatively or regulatory wise. But if you take a worst case scenario and a best case scenario view of it, people would lose sleep. I can give you a worst case scenario for both home health and hospice that would make you want to leave the business, because of parties like MedPAC out there. I mean, the 20% reduction in the hospice cap, would take 67% of hospices in California and put them over the cap, meaning they'd be paybacks, to the Medicare program for that 67%. So we think we're well prepared to battle those kinds of threats that might be out there. We actually look at 21 and 22 from the home health side, and the question we raise is, does Medicare owe us some money? Because the behavioral adjustment does not seem to have been realized. It was all based on assumptions, speculation on changes in practice. The data needs a lot of serious analysis to determine whether or not they have underpaid home health agencies, but one would favor leaning that direction rather than the opposite, which could trigger further behavioral adjustments in the 2022 era. We've already asked CMS to start looking at possibly a mid-year adjustment if the data proves us out in that regard. Hospice still has the luxury of being one of those children they protect, but it's starting to lose that safety status that it has because of some of the fraud and abuse to the surface, some quality of care issues that are there. But you would still see a fairly stable ride in the near term for both home health and hospice on the reimbursement front. If I were to look at anything that raises concern more than anything else, is the growing proportion of Medicare Advantage enrollment with that population turning age 75. And I would imagine most home health agencies would agree that Medicare Advantage is not as good a business as traditional Medicare. And the balances of proportionate enrollment varies geographically in significant ways, but overall it is growing. And so we hope, and this is where you get on the Pollyannish side of it, we hope that those managed care players out there start recognizing the value that was demonstrated in 2020 in COVID as to how important home care can be in so many capacities, for them to get out of their silos at Medicare Advantage plans and see that kind of dynamic value. That's the Pollyannish part of it. But if I'm factoring anything into the future reimbursement wise for home health, it is the degree to which Medicare Advantage is playing a part in that particular home care company's operation. And on the hospice side, you've got the VBID project underway, which would carve hospice into the Medicare Advantage plans, but that's not a near-term issue. I mean, we're looking at a 4-year demonstration program. First 2 years are less consequential than the second 2 years, but it's still very limited uptake on that demonstration program. We don't think Medicare Advantage should be in hospice, but we may not have the ability ultimately to control that in the end. So what we have to do is a dual track, try to prevent that expansion, while at the same time getting those Medicare Advantage plans to understand hospice better in terms of its value proposition.
Yeah, I agree with you, Bill. I mean, when you look at a home health agency, one of the first questions we always ask is how much is traditional episodic versus how much is how much of your what you call Medicare is your Medicare Advantage, because they have totally different bottom lines and they have totally different valuations. Joe, anything you want to add to that, since that's your area on the Advantage stuff, or we kind of covered it all?
I think we've covered it. Bill did a very thorough job there.
Okay, so let's talk about Medicaid on the home care side. Are we seeing more or less Medicaid businesses on home care? And what role is that playing? From my perspective, we're actually seeing a lot more transactions, and we're seeing a lot more interest in that, both overall private pay, but also Medicaid non-skilled care. You'll see more of these businesses that they seem to be growing quickly. They seem to be able to be larger than people would thought they'd been, and they would also you're starting to see some that are multi-state. Bill, Joe, or Brian, and Brian's got I probably did Brian a disservice. He has a home care background as well. We just haven't emphasized that part of it on this talk. But Bill, I don't know if you want to start about Medicaid home care services.
Medicaid is a very important area to examine in home care. It is so much larger than home health and hospice combined, and you add behavioral health to it, Brian, and you're looking, into the $150 billion range, perhaps, when you put it all together. But home and community-based services waivers programs under Medicaid alone are now closing in on $100 billion a year. But I think what you're seeing, in the marketplace is a recognition that to be able to manage Medicaid home care, you need high volume. You're managing to the penny. If there's any margin at all, it is pennies, and volume then matters. And real big area to deal with Medicaid is the same on the private pay personal care services side. That's recruitment and retention of workers, because one of the highest costs those companies have is recruitment and retention. It costs a couple $1,000s to replace somebody. And you're looking at issues regarding $15 minimum wage, trying to control overtime compensation issues because the Medicaid programs are not doing it. But President Biden on the campaign trail sent a message to all people looking at Medicaid, home and community-based services. He said, he's bullish on it. He wants to continue to rebalance long-term supports and spending towards home and community-based care. There's plenty of room to do that. For those of anybody listening in who's got an aging parent or aging themselves, it's important to recognize that you probably have a better chance of getting home and community-based care in Oregon than you do in Mississippi. With Mississippi, 25 cents on the dollar is going to home and community-based care compared to Oregon. But there is that renewed energy and effort to support home and community-based care. You will see the stimulus bill coming out of the House of Representatives this week, which will pump in an additional $9+ billion into home and community-based care to help support the workforce with hazard pay, covering training costs, covering a number of other kinds of things. So for me, Medicaid is an incredibly valuable part of home care. Difficult to run it, but a future that's undeniable. Medicaid does not want to pay for people in nursing homes anywhere anymore.
Yeah, I agree wholeheartedly. Joe, Brian, any comments on Medicaid and what's going on? Joe?
I'm seeing a large demand for Medicaid actually right now. Now, the caveat to that is they typically want large because, as Bill said, it's a high volume, low margin business. So a lot of the financial and strategic buyers coming out asking for Medicaid, they're looking for a large amount of volume because they don't want to have to go through the pain of building it. But yes, I'm seeing the demand very high for Medicaid. And Rich, did you also mention private pay as well?
I kind of threw it. It's non-skilled care, but yeah, we're seeing a higher demand for that as well. So those agencies have a harder time scaling up than the Medicaid businesses do.
Well, I'll just piggyback on what I just said by saying that I'm seeing also a large demand for private pay. There are a number of regional strategic companies that are getting nice momentum, and they're looking to buy these. Sometimes they're $1.5 million top end revenue companies, but they can sell them like hot. They can sell them like crazy because there are a lot of buyers out there that want that. That's a little bit of a different business model than Medicaid, but there's demand for both, I guess, is the punchline.
Okay, I got a couple questions, and I'm going to try to incorporate some of the ones that have been sent in to me as well. We got about 10, 15 minutes left, 10 to 12 minutes left, I guess. Brian, if it's okay, we'll start with you. Are there any particular, I may have asked this, I don't think we gave a clear answer. Are there any states that are really hot, and then anything in particular you would tell people wanting to come to market, or what's going on?
Yeah.
And let's go ahead and do our closing comments at the same time. So
Sure thing. So, in general, there's a handful of states that continue to be kind of the hot places for services. Ohio, Virginia, Tennessee, North Carolina. Those are the places that I'm probably getting the most requests for. Having said that, really the Midwest has come on pretty strong. I've had a lot of folks asking about Pennsylvania, New Jersey recently. Some places in the Southwest, Arizona, Texas, but generally, as long as you're not in California or New York, there's pretty strong demand for IDD services. Those two places are just a bit off, but really anywhere else in the country, there are buyers looking, which is always a good thing. In terms of what folks should prepare for. I have people call me all the time and say, do we need to wait until we get on the other side of COVID and have a full year of numbers that we can show a potential buyer? And the answer to that is, these folks are sophisticated enough to model around what we need to kind of project this thing out long term, as opposed to what the past year has done to the industry, and which is a good thing. So for folks that are looking, we don't need a long history of financials. Most folks are able to go back and model based on what the past was and project it going forward. So, but in general, my comments again, I'm really excited about what 2021 has to offer for the IDD industry specifically. I think there's going to be just a ton of activity as some of these newly formed groups are getting out and getting active in the marketplace. And I think we're going to see valuations continue to rise. I had a buyer yesterday that I talked to. It was funny that, they've been in the industry for a long time, and they said 10 years ago, they could call a seller and they wouldn't realize that they had something of value. And now he gets cold calls from potential sellers and say, I'm not selling for less than 10 times EBITDA, and I know what my EBITDA is, which is just a complete, change in kind of how folks are looking at this marketplace, which ultimately I think is going to be a good thing for sellers. I think it's going to be very active, and I think valuations are going to look really, really nice for the next 12 to 18 months for sure.
And before we move away from you, Brian, one of the things I want to ask all of you is something I skipped over in my notes, technology, telehealth, monitoring systems. What are you seeing in your area with the developmental disabilities clientele?
Yeah, so while I wish I could say that COVID really accelerated us to a place where we're fully using technology to help care for these folks that are so vulnerable, we're just not there yet. And I think we're years off from being able to really leverage technology the right way in the IDP space. Having said that, we've seen some incremental steps. I know some providers that have set up their own telepsychiatry systems. It's hard to find a psychiatrist that understands the IDD population if you're in Great Bend, Kansas. But if you've got somebody that you can pull from in a larger metro market, it's obviously of great benefit to the client and great benefit to the organization. So we've seen some baby steps in that regards, but unfortunately we're still some years off from seeing a full rollout of technology that we could use in the space.
Thanks, Brian. So switching to you, Joe, what 2021, if you've got people looking to sell, what would you tell them? Closing comments, and then anything with technology as well would be my three things I ask you to talk about.
Sure. Well, regarding technology, it's funny. 20 years ago, we thought that telehealth was going to be what everybody was doing all day, every day. And I see it. I see it a lot more now than I used to, but I'm still a bit surprised that I don't see more of it. I think a lot more focus was put on it when COVID sort of helped light a fire under some people. And I think it's gotten more attention. I'm surprised from my days as an operator how much better the actual EMRs have gotten in terms of just their capacity. So I think that helps operators a lot. But in terms of 2021, I was an operator for 24 years, and I never try to tell my clients what to do other than run your company like you're going to run it forever. However, I'll say this: if you are sitting on go to sell your company, if you really want to sell like immediately, then I would look twice at going into the second round of PPP loans. I'm not telling anybody what to do. That's just an observation, because the first round, while I know it was extremely helpful for a lot of the market to help them weather that storm, that was what it was designed to do. They are a bit of a thorn in the side when you get to the point of selling a company. It's not that it can't be conquered. It's just that that money's probably going into an escrow account, and it's going to delay the time it's going to put a gap between the time of closing and the time you receive it, unless you get forgiveness prior to closing. So if you're sitting on go and you are in the process of signing up for the second round, if you don't need it and you really want to sell, I might think twice about that. But in terms of 2021, as I said, I'm bullish about the where we sit. If you're an operator and you've got a good company, trust me, there are a lot of people out there that probably want it, and I'm excited about it.
Thanks, Joe. And then Bill, we'll end with you, sir. So a little bit about telehealth or any technology you see playing a bigger role in this area, and then final comments to leave people with looking forward?
Well, we're quite, pleased to see finally the movement towards telehealth in so many ways. We have a lot of ways to go, Joe. I remember that same era where people bought all this equipment to set in closets gathering dust. That's not the case anymore. But we're not yet at the point, to help out, Brian's constituency, the personal care services side and group homes and the Medicaid side and home care. I think the label I came up with is we haven't moved to the generation of the carinator yet, to coin the Terminator opposite, where you have robotics or androids that could provide that kind of personal care. I read a lot of science fiction and comic books still, so I think that way at points in time. But I think what we have to make sure we do on a going forward basis on the technology side is recognize that at least today's telehealth is a tool, it's not a service. And that you've got to have it work right with the right people, using it at the right time in order to bring about the kinds of clinical outcomes you want and efficiencies that you may need going forward. So very positive on the telehealth side, but it's not a panacea in and of itself. Otherwise, I'll close with a remark. It's an observation and perhaps a recommendation from someone who never owned or ran a home health agency or hospice, that being me. I think that people definitely need to be looking at horizontal integration, either actual or virtual. And I mean by horizontal is home health, infusion therapy, hospice services, private pay personal care, private duty nursing, Medicaid personal care services, et cetera, because a lot of the activity that's going on in healthcare today is looking for that one-stop shop in the community. You can do it virtually, or you can do it in an actual basis. But you take a look at a number of the companies out there, you'll see that's the movement that they are making. I'll add one last thing relative to the subject of the moment, deals and such like that. I had a very large company CEO say to me, when something comes up on the market, I buy it as fast as I can because I know somebody else will buy it if I don't. And so that's the energy around people's view of the future of care in the home.
Okay, no, I agree. It's very active. Gentlemen, thank you for joining us. I hope everybody enjoyed it. You have our contact information on the website. This video will also be posted on our website, stoneridgepartners.com. And we will have an announcement of our second quarter one in about 3 months. It'll come out in 3 months. We'll do another one and have some excellent guests that we're courting to come on with us. So Bill, thank you very much. I appreciate your time. Brian and Joe, I'll talk to you later today.
Thank you.
Thanks.